Hello, everybody. This is Dr. Adam Rindy, and welcome to the One Thing podcast. Here we bring together experts in naturopathic, integrative, and functional medicine to speak about topics such as gut health, brain health, performance, longevity, and also we dive into chronic diseases that are very troubling and difficult to treat. In these episodes, we're looking for key elements, perhaps one thing that may turn the tides in the health of our listeners and in the health of your patients. These key elements are buried in the details, so we're looking to unpack some of these key concepts and hope to improve the health of you and your patients. Thank you for tuning in, and stay tuned for today's episode. If you suffer from gut-related disorders such as inflammatory bowel disease, IBS, gastritis, GERD, you know how much your digestion plays a role in your overall health. And conventional medicine has many options to help control these diseases, but often people are left with residual problems such as chronic pain, diarrhea, constipation, reflux, and there's something missing in the overall approach. In the recent history, medical cannabis has been utilized in some of these conditions to help with some of the pain, discomfort, appetite problems, digestion, motility issues. And we wanted to bring back Dr. Nick Jikomes, who was with us in part one of this episode, to give us an overview of medical cannabis. In this episode, we dive into specifically more gut applications of medical cannabis. He'll take us through the different mechanisms of how medical cannabis, such as CBD and THC preparations, might help with gut motility disorders. He'll also talk to us about how to go about finding the proper medicine for your specific gut-related problem. So join us in this most interesting episode about gut applications of medical cannabis. Without further ado, I'm going to jump right into the episode with Dr. Nick Jikomes. Dr. Jikomes, welcome back, and thank you so much for joining us again and speaking with us about medical cannabis and cannabis. Last segment, you gave us a great overview of all the different components of the endocannabinoid system. In today's segment, we're going to speak specifically about GI disorders. And welcome back, and thank you for joining us with this.
No problem.
Yeah. So we were speaking last time a little bit about just sort of the overview. And today I'd like to go in and hear your thoughts a little bit about how cannabis can be utilized in gut-related disorders and just sort of your thoughts about the general applications.
Yeah, absolutely. So I think cannabis has a lot of potential application here. And the reason for that is that, if you take a bird's eye view of the medical literature and the medical benefits that cannabis tends to have, most of the time it is related to things that have to do with inflammation. And so a lot of the disorders where there's good clinical evidence for cannabis being effective, things like MS, for example, these tend to be disorders where the immune system is overactive. And the reason cannabinoid-based therapies are often good for inflammatory conditions is that these compounds tend to have pretty potent anti-inflammatory effects. And that's definitely true for things like THC and CBD. So THC, for example, I believe it's actually more potent than things like aspirin or hydrocortisone as an anti-inflammatory, at least under certain circumstances. CBD is also anti-inflammatory. And so most of these cannabinoid compounds and some of the terpenes as well tend to have anti-inflammatory effects. They tend to have immunosuppressive effects. And so for conditions that involve excessive immune system activation or excessive inflammation, cannabinoid-based therapies are typically good candidates for something that's likely to have some kind of benefit, although there's lots of details and caveats to go into there. For something like GI health, I think that's a really interesting area for a couple different reasons. One, if you're talking about something like colloides or IBS or things like that, these are inflammatory conditions. There is excessive inflammation. There's too much immune system activity, more or less, in the gut. And that causes a lot of discomfort and a lot of problems for patients that suffer from those things. And because these are pathologies related to inflammation, cannabinoids are good candidates for something that is likely to help those patients because of their anti-inflammatory effects. So I think there's a variety of things to talk about there. One is just the potential benefits for things like THC, CBD, or other cannabinoids for these disorders. And the other is the connection that we talked about in the first part to diet. So, there's some interesting research out there showing, again, that, when you consume either THC or CBD with a high-fat diet, you're actually going to get much better absorption into the gut system of those cannabinoids. And so for something like a GI disorder in particular, I think it's doubly important to be very mindful of how you're consuming your cannabis. If you're consuming it orally, which seems like a natural choice for someone with a GI disorder, because it's going to go down your esophagus, it's going to go into your stomach, and it's going to go through your entire digestive tract and get absorbed in the gut. And so if you're doing that with a high-fat diet, you're going to get much better absorption, and I would think much better symptom control of your condition. But again, it's important to talk about this with your physician and what the right approach is for you. Do you want THC because that's going to have some psychoactive effects for you? You might want to avoid those psychoactive effects. On the other hand, I know that a lot of patients do have benefits that they see from THC because, again, THC does have anti-inflammatory effects itself. It does have medical benefits it can have. Some people get confused, I think, and they think about THC as sort of the fun recreational cannabinoid. It's the one that gets you high, and CBD is the serious medical cannabinoid. And it's the one you take as a medicine. And that's too simplistic. That's not a good way to think about these compounds. Both THC and CBD can have medicinal benefits, and you might get really good outcomes from one of them. You might get really good outcomes from a combination of both of them. And it's really up to you as the patient to do some experimentation in consultation with your doctor about what the right approach is. And typically what I see, when I talk to medical patients, and I don't do that, I'm not a physician, so I don't do that as part of a practice. But when I talk to patients as part of my job for Leafly, or when I meet them in my personal life, or when I'm talking to their doctor, when I talk to medical cannabis physicians, a key component of all of this is experimentation. So try a product that's higher in THC, try a product that's higher in CBD, try a balanced product that has both. Make sure you're experimenting with how you consume that. Are you consuming it orally with a high-fat diet? Are you vaporizing it? Are you using a tincture? All of these things, I think, are going to impact the outcome for a patient because they're all going to impact bioavailability and how much of those compounds are actually getting to where they need to get in the body.
Yeah, and I think the time when we spoke last time, you were talking about the CB1 and CB2 receptors. I think it's really important when we're thinking about this topic of the gut is to know that these receptors are all throughout the enteric nervous system, right? Throughout the GI, and so we're with this particular medication or with cannabis, you're modulating that whole system by potentially with a balance of CBD and THC or one or the other.
Yeah, absolutely. So, both of these receptors are found in cells in the gut. Again, in general, outside of the nervous system, CB2 receptors are more common, although you do find both receptors. What I can tell you is, I think you got to take it on a case-by-case basis. Everyone's body is unique. Everyone's endocannabinoid system is different in terms of how these receptors are distributed throughout the body and in particular tissues. And so for some patients with some conditions, a THC preparation might be the best way to go. For others, a CBD product might be a better way to go. And for others, a mixture of both, a balanced 1-to-1 or 2-to-1 combination might be best. And I think for gut health, for something like a GI disorder like colloides, it's very natural for me to speculate that potentially both compounds could be effective here because on the one hand, Both of them are anti-inflammatory. They tend to have anti-inflammatory effects. And that's good if you're looking to treat an inflammatory disorder like colitis or something like that. But like we mentioned in the first part of this podcast, each compound has very different mechanisms that it interacts with in the body. And so, your body might need one, it might need both. And it's important just to do that experimentation and see what works for you.
Yeah. And I think, it's really important from a clinician perspective for me to point out sort of different scenarios. And maybe you can pepper in on this as well, is that, we do know that some of these receptors slow down motility. So like CB1 and CB2 are generally going to slow down motility. So typically I would lean towards using these in more of like a diarrheal scenario, like a flare up with colitis or a flare up with IBS, like IBS-D, which is to stabilize someone, sort of having a go-to to use as needed in a flare. Because of it's not likely to help someone who's constipated or is having like slow motility. It's more likely to help stabilize someone who's having kind of rapid motility.
Yeah, I think that makes a lot of sense. And, it sort of relates to the idea of homeostasis and the natural, the body's natural use of endocannabinoids is in this highly regulated, very precise way. It's not sort of releasing endocannabinoids all the time, everywhere. It's doing it only when and where in the body it's needed. So when your endocannabinoid system is functioning normally, we talked about an example from the brain, but you can also talk about this in terms of the normal functioning of the immune system and the normal inflammatory response. The normal inflammatory response happens at a particular time in a particular place. So you get an injury, you get an infection, you want your immune system to kick in where that infection is happening, and you want it to stop the infection, and then you want it to go away, right? You don't want to have chronic inflammation because that can lead to collateral damage. Essentially, you can damage your own body when your immune system is too overactive. And so that endocannabinoid system is often used to restrict the inflammatory response so that it's only used at that appropriate time and appropriate place. And I think by analogy, what you said is probably, it makes a lot of sense. You want to use these cannabinoid medicines, these cannabinoid products when they're needed. And so when you have something like a flare up, you can use them to help rein in that inflammation. Then it may not be, you may not want to keep using them chronically because it may not be appropriate. You want to use them mindfully to reduce inflammation when it's inappropriate, but you don't necessarily want to suppress the immune system across the board on a chronic basis.
Right. That makes a lot of sense. And I just wanted to emphasize that when we're talking about these topics or these different strategies, it's really important just to be clear with your gastroenterologist or your doctor about just your different ideas and team up with a healthcare provider to sort of map this out, make sure it's going to work with your existing regimen and all the different parameters, and also with employers and those types of things. So I just want to say that because I think it's important for people to not necessarily experiment on their own or just to feel like they don't have a voice in their care. These are therapies that are even approved by the Department of Health for medical use. And so you can certainly bring it up with your provider, and we're all here to listen to you. One of the other things that I'd like to really say is that, most of these GI disorders are related to kind of a mind-gut system. So, it's often the case that someone who has a flare, an IBS or an IBD flare, that's something that precedes it will be a really stressful period of life, or sleep disruption or anxiety, or something acute that happens that will disrupt the central nervous system. And so I often think about strategies in this realm of using sort of a daily sort of mind balance approach with some of maybe a CBD dominant approach, and then for the flare, something that's more of a kind of a hybrid, or that's kind of my thinking. It has been my thinking for the past few years. Can you talk about that a little bit?
Yeah, no, I think this is a fascinating area, and so there's a variety of things that I think we can tie together here. So when thinking about the gut, right, you've got a lot of neurons from the central nervous system that reach down into the gut and interact with it. You've also got a lot of compounds that we normally think of as brain compounds, like serotonin, that are also used in the periphery as signaling compounds in biology. And so when you're thinking about gut health, there's a lot of talk these days about the microbiome and the health of your microbiome. That's not something that I'm an expert in, but I know that's a very important and hot area of research right now. And there's also all of these interesting gut-brain interactions. In fact, when I was in graduate school, a lot of my focus had to do with circuits in the brain that were related to feeding behavior. And there's just a lot of interesting biology about how neurons that reach down to the gut and connect to your digestive system interact with your brain and all of the other circuits in the brain that do other things related to cognition, emotion, and behavior. So there's this really rich area to think about there. But one place to start, I think, is I do know that a lot of GI disorders correlate or are potentially caused by misregulation of the serotonin system. So serotonin is a very important molecule. We normally think about that as a brain neurotransmitter because it's one of the most famous neurotransmitters in the brain, largely because it does lots of important stuff and it's a major target of mental health medications like SSRIs. So a lot of medications that we use to treat depression and anxiety target the serotonin system because serotonin is very important in the regulation of mood. At the same time, I think an interesting observation is that a common physical side effect of things like SSRIs are side effects of the gut. So people often have negative side effects in their gut when they're taking SSRIs. And that's because serotonin isn't just used in the brain. It's actually an important part of gut regulation generally, although I'm not so familiar with a lot of the specific physiology there. And I think that's really interesting when we think about things like gut health and we think about things like plant medicines. So not only are THC and CBD important anti-inflammatory compounds, and that's why they're potentially useful for things like GI disorders or treating inflammation and flare-ups. But things like CBD also interact with the serotonin system. So one of the areas where there's relatively strong evidence for the medical effects of CBD is in anxiety. And in general, CBD tends to be anxiolytic. So you can imagine, and it's actually through its ability to stimulate the serotonin system in the brain. So it's interesting to start to speculate about, something like CBD sort of being this dual purpose compound. It can affect things like inflammation to treat IBS or inflammatory conditions by treating the inflammation per se. But at the same time, it might be a good add-on to help people lower the anxiety levels and things like that. And then another area that I think comes into this is this emerging area of psychedelic medicines that you might be hearing about in the news a lot lately. And in fact, some of these psychedelic compounds are typically characterized by their strong ability to activate the serotonin receptors in our body. And some of these compounds probably also have anti-inflammatory effects. I know that that's an area of research that's ongoing. For example, some of the serotonergic or serotonin activating psychedelic compounds can actually have very strong anti-inflammatory effects. And in animal models for things like asthma, they've shown very strong anti-inflammatory effects that can prevent the onset of flare-ups in asthma, even at doses that are much below where you would get a behavioral or a true psychedelic effect. So if you've heard about things like microdosing LSD in the news, these things are actually stimulating the serotonin system and potentially have a role to play at sub-psychedelic doses in inflammatory conditions. So I think all of these plant-derived compounds or plant-related compounds are very interesting. And it's an area of ongoing research. So I think we're going to start to hear more and more about this in the coming years.
Absolutely. And I want to point out that when we talk about inflammation modulation from these different compounds, the sort of collateral or effect of that is that there's less pain and discomfort. So with a lot of GI disorders, there's pain or there's what's called visceral sensitivity. And so the part of the therapeutic strategy of using these plant compounds would be the pain modulation or less visceral hypersensitivity, meaning you just don't feel as much tummy pain or
Absolutely.
in IBD, it can be really severe pain in specific spots, and that can be downregulated, and which may be able to lead to better sleep, which improves everything, right?
Right. Yeah. And like, it's worth mentioning too that, THC can have pain relieving qualities on its own. It can be analgesic. And sleep, sleep is a relatively common thing that medical patients use cannabis products to treat. And that can include THC. So again, it's important to recognize that THC's, it's not the fun compound only. It does have potential medical benefits itself. And it's important, I think, to consult with your physician about using THC products for a couple of reasons. As we've mentioned, it can help with the inflammation, it can help with the pain, it can potentially help with the sleep. At the same time, I think a lot of patients get scared of THC because it is the intoxicating, strongly psychoactive compound. But at the same time, I think those pain relieving qualities and the euphoria that you can get from the psychoactive component can actually be helpful for some patients that have unpleasant pain as something that they're dealing with. And so, being mindful about how you approach your use of THC, I think is important. Start low and go slow with the dose, and work with your physician, but don't be dismissive of THC outright. I think some people want to avoid THC because they think it's all fun and no benefit. But I think for a lot of patients, there is potential for THC to help both with the pain and with the inflammation.
Right. And I think the important thing that I'm trying to elicit from these conversations we've had is that, just knowing how things work is going to make things much less of a sort of barrier, because it's like anything, if you're taking a medication, whether it's a plant or a pharmaceutical, if you know how it works versus just sort of jumping in with kind of like an experimental approach, then it's going to be a lot different. So if you know how it works and what you're expecting to experience, whether let's say that a person selects a strain that's 80% CBD versus and 20% THC, they'll know what to expect from that strain versus just kind of going in and not knowing what they're likely to experience.
Yeah, and I think that's critical, especially in the legal cannabis industry, because when you walk into a dispensary, you're going to see strain names and you're going to see brand names, and you're going to see fancy packaging and shiny labels. But at the end of the day, the effects of that product are going to be due to the chemistry of that product. And so the more that you can empower yourself as a consumer to actually understand the chemistry that works for you, the better able you're going to be to select products that are going to deliver the effects you want on a consistent basis. And so that kind of ties back to our earlier discussion of the Leafly Cannabis Guide. So if you go onto Leafly, you can read about the biology of the endocannabinoid system and how cannabinoids work, but you can also start to compare and contrast strains based on their actual chemistry. And I can't emphasize enough how important it is to do that, especially as a patient where you have, very serious potential condition that you're treating. You want to learn on your own and work with your physician to figure out what is that chemistry that works the best for my body? Is it 2-to-1 THC to CBD? Is it like CBD dominant, pure CBD? Is it, a hemp-derived extract that has a certain percentage or concentration of THC, CBD together with other compounds? Once you can sort of figure out what the chemistry is that causes the outcome that you're looking for, you want to use that knowledge to go buy products that have been lab tested and that can produce and give you that chemistry on a consistent basis. Otherwise, it's sort of like the Wild West, right? You might go out and buy a product with a particular strain name. Let's say you go out and you buy Charlotte's Web, a Charlotte's Web product, and you use that product and it works really well. If you go to a different dispensary or you buy a Charlotte's Web product from a different brand, just because it has that name Charlotte's Web doesn't mean it's going to have the exact same chemistry. And so you might be surprised when you don't get the effect that you got the first time. And so, understanding the chemistry and understanding what the ingredients of the product are is very, very important in my view.
Excellent. And so let's go into that a little bit further, because most physicians, that write authorizations for people who are needing medical cannabis really don't know a whole lot. And, hopefully that's improving as far as like how to specifically direct patients. So let's say a patient jumps on Leafly, they're still feeling somewhat overwhelmed. And where would you direct them? Like what's to look for in like a medical dispensary? Like what are some of the key qualities of working with someone who's within the industry?
Yeah. So I think we should think about the journey from start to finish. So, let's imagine a medical patient and they've got some condition, right? Let's just say that they have, colitis or something. And they're experimenting with cannabis. And so let's just assume that they're going out, they're buying cannabis flower products. And I'm making that assumption because that's the most common product category out there. So they're buying flower and they're interested in trying different strains to see what works with their IBS. So a lot of times that learning journey starts with Leafly because people will, Google a strain name, maybe Charlotte's Web. Let's use that as an example. If you're an IBS patient, you're interested in a high CBD strain, someone told you about Charlotte's Web, you end up on Leafly on the strain page and you try that product. So you can go onto Leafly and learn about Charlotte's Web. You see that it's a high CBD strain. So the visual representation of that strain has a lot of circles, and you can read in detail about the chemical composition that strain tends to have. You read about what other consumers are saying about that strain and what they've used it for and what they have experienced. And then you find a product, a Charlotte's Web product at a dispensary nearby on Leafly, and you go and try that product. Let's say that you try that product and actually it didn't work that well. It didn't give you quite the effects you wanted. So you go and you start doing more research on Leafly and you want to find a different kind of strain. So if that one didn't work, what you want to do is find a strain that likely has a different chemistry. So maybe in your research, you realize, okay, I tried that high CBD, CBD dominant strain. Now I want to try something that's a little bit more balanced, something that has a little bit of THC and CBD. So you find something that has both diamonds and circles, a strain like Harlequin that has a little bit of both. So you go try that product, you find where it's available at a dispensary nearby. You can order it online. You try that product, and let's just say that works better. So you've tried two strains now. One is CBD dominant, and it's got mostly CBD. The other one's got a balance of both THC and CBD. And maybe that helps your IBS symptoms a lot more. What you want to do is take that learning and that understanding and bring that to your physician. And I think that's going to empower your physician to help make much better recommendations for you compared to if you just came in and said, I tried cannabis and it either did or didn't work for me. If you can come into that conversation and you say, look, doc, I've tried something that's high CBD dominant, Charlotte's Web. I've tried something that's balanced. It's actually got both THC and CBD like Harlequin. And the second one worked a lot better. Now your doctor can take that information and they can go onto Leafly and see what that means in terms of the chemistry. And now they can use that to make a much more powerful recommendation to you about products that they know and they trust, because now they know that they're going to want to have something that has a similar chemical ratio to what you just told them. And I think if you can get to that point with your doctor and you have that conversation, not just what worked and what didn't, but what was the actual chemistry, what were the actual ingredients of the thing that worked compared to the thing that did not work?
Yeah, I think that's excellent. And I will say that there's a lot of quality medical dispensaries in the area. I'm sure people are listening to this throughout the world, so that's not the case, but at least in our area, to do your research also to see if there's staff on hand to answer questions at some of the medical dispensaries. And we do. And how they go about answering questions is a really good clue, is if they take their time and explain things just like Dr. Jikomes has here today. I think these are all really important qualities versus some dispensaries are more recreational driven. And some are more medical and some are both. You got to really be, know what you're looking for. Yeah.
And actually we try to connect all those dots for consumers on Leafly by making it really easy to do a variety of things. And that ranges from, reading articles to just learn and increase your own knowledge base. That includes the strain database. So you can go and compare and contrast strains based on their actual chemistry, which is something that you couldn't do, even a year and a half ago on Leafly, and you can't do almost anywhere else on the internet that I'm aware of. But it also allows the consumer to compare and contrast dispensaries. So as a consumer, you can go onto Leafly, you can try and figure out what strain or what product you think is best for you. You can then find where that strain or that product is available across a set of dispensaries in your area, so that you can kind of compare and contrast like the menus and what's on them. And then, as you go to those dispensaries and you find the ones that work for you, you can keep going back to them. And then the other thing that we actually do for medical patients is you can actually find doctors on Leafly as well. So in your area, there might be a variety of doctors available. And so just like you might compare and contrast strains, you might compare and contrast products and dispensaries, I think it's also important to compare and contrast doctors. And like Adam mentioned, find one that works well with you, that takes the time to really explain things, that wants to know the details of what your symptoms have been, what products you've tried, and just make sure that you do all of that due diligence and shopping online and do that comparison. I think almost you can think of it like comparison shopping with doctors until you find a doctor that's really going to work with you to help you at that appropriate level of detail.
Great. Well, you've given us a lot of good messages through both of these segments today and the one we did on the overview. And so I think it's probably a good opportunity right now to kind of give you a chance to share ways for people to keep learning from you, or other projects you're involved with, or how people can find out more about your work.
Yeah, absolutely. So I'll take a moment just to describe a lot of the work that I've done at Leafly, and then kind of point people to where they can learn more. And so for my role at Leafly as the Director of Science and Innovation, I've really been doing a number of things, but one of the most exciting areas for me that I've been focusing on for a couple of years now is I've actually been working with cannabis testing facilities all throughout North America. And so these are the laboratory facilities that actually take in all of the products from all of the producers out there, and they're actually measuring the cannabinoid and terpene content of these products. So they're telling us really important information about the chemistry of all the strains and all the products that are out there. And so we work with those labs all throughout North America, in the US and Canada, to take in that data and understand the chemistry of cannabis in new ways. And so what we're doing for consumers is we bring that information to them on the strain database with our new cannabis guide to visualize the chemistry of those strains, so that you can actually see what the THC, the CBD, and the terpene content actually are for these things. And we've been doing a lot of interesting research behind the scenes as well. And so that's been a huge focus for me. And there's a lot more that you can read up on Leafly. So you can kind of go see what we've been working on by looking at the strain database. There's a lot of exciting content that we've done around, the chemistry of strains, the endocannabinoid system, and how the cannabinoids that you find in cannabis products connect to all those things. So I would encourage you to go to the Leafly content section and read up on those things. And lastly, you can also just follow us on social media, on all of our social channels. So Leafly is constantly sharing educational content on its own social channels. I'm also relatively active on Twitter. So my handle is at Trikomes, Trikomes. It's sort of a combination of my last name and trichomes, which are the structures on cannabis flowers that actually secrete the essential oils, the cannabinoids and terpenes of the plant. And so I often share what we're doing at Leafly. I might share studies that I'm reading that I find are interesting, that relate to some of the things that we've talked about on this podcast, and a number of other things that I think are very educational. So those are all the places I would look. You can go to Leafly, download the app, or go to leafly.com. It's always new and fresh. There's always new content to look at, and there's always new features that we're releasing. So we appreciate people going to Leafly and giving us feedback, so we know what to keep building.
Thank you so much. That's so great that you've shared a ton of information for us. And I know there's other areas of research for us to pay attention to as we go, like the terpenoids. And then we talked about potentially some other derivatives like CBG and the psychedelics. I mean, this is just a emerging field of medicine, and it'll be fun to follow your career and keep in touch with you from time to time.
Yeah, thank you very much for having me. This was fun.
You're welcome. Well, thanks for being here, and thanks everybody for tuning in. Just pause for a brief message.
Hey everybody, this is Dr. Rindy again. Thank you for tuning into this week's episode. I hope you enjoyed it. If you did, please share this episode with your friends, loved ones, and patients. And also press like or subscribe in your podcast player. Please share this widely on Instagram, Facebook, and other social networks like Twitter. We want to get these episodes out into the hands of the people who need them. Having access to information that can make a difference in your health is something that should be global and accessible to anybody. So we want to make sure that people hear about what we're doing over here on the One Thing podcast. We appreciate your support, and please continue to tune back in. We know there's a lot of podcasts to choose from, and we really appreciate that we are someone that you listen to. Thank you again, and we'll see you next time.